Common parrot diseases symptoms, a health guide. The parrot is one of the most affectionate birds that people keep as pets, but here given the common parrot diseases symptoms go unrecognized because we are unaware of them. Parrots are among the world's most intelligent and beautiful birds. Parrots, like all living things, are susceptible to a variety of ailments. They are also affected by a variety of diseases, each of which has its own set of symptoms that manifest in the behavior of the parrot if the disease is present. 1. Aspergillosis, one of the best-known parrot diseases. Aspergillosis is probably one of the best-known parrot diseases. If your parrot inhales the fungal spores of the Aspergillus fumigatus fungus found in the environment through the air, they enter its respiratory tract where they form a dangerous fungal growth. How to recognize and treat aspergillosis. Affected parrots typically suffer from respiratory problems and sometimes from neurological symptoms. Once the vet has diagnosed aspergillosis, for instance, with an X-ray examination, they treat your parrot with antifungal medication. The effectiveness of the treatment depends on the extent of the fungal infestation. 2. Psittacosis, notifiable infectious disease. Psittacosis is also one of the most important parrot diseases. It is a notifiable bacterial infectious disease and is triggered by Chlamydia psittaci. Chlamydia enters the body of different bird species via different pathways and leads to flu-like symptoms when the disease breaks out. However, the disease can also affect both other animals and humans when it is referred to as ornithosis. How is psittacosis recognized and treated? In case of suspicion, vets send swab samples to a laboratory that cultivates the bacteria or detects them by molecular biology. If the laboratory confirms the suspicion, your vet will treat your parrot with antibiotics. You should also follow the mitigation strategies suggested by your vet. 3. Pashiko's disease, an often undiscovered parrot disease. Herpes viruses cause Pashiko's disease in parrots. If your bird becomes infected with the causal virus through the air or its beak, it will infect numerous organs through the blood. However, most parrots or parakeets only get sick when they suffer from stress, but they die within a few days once they do show symptoms. How is Pashiko's disease recognized and treated? Before birds die, their general condition is poor and they show gastrointestinal symptoms. As a result, vets only have a short period of time to detect the virus via a swab sample, which is why a pathologist usually makes the diagnosis first. 4. Psittacine beak and feather disease. Parrots and budgies contract deadly PBFD, also known as feather loss syndrome, via a droplet infection with circoviruses, which settle in the feather follicles, skin, esophagus, and goiter. Depending on the age of the infected bird, it becomes ill either paracutely, acutely, or chronically. Can you treat PBFD? PBFD typically leads to changes in your exotic bird's feathers and bones. If the vet has detected circoviruses via a PCR test, they can only prescribe your parrot supportive medication such as painkillers or vitamins. Unfortunately, there is still no cure for this dangerous parrot disease. 5. Neuropathic gastric dilation, fatal neurological disease. Researchers have not yet been able to clarify the exact cause of neuropathic gastric dilation in birds. However, they suspect that bornaviruses cause this fatal neurological disease. Parrots, parakeets, and other bird species too can become infected via contact with contaminated feces or feather dust. In the body, the avian bornaviruses that prefer to infect birds cause the nervous tissue to become inflamed. How is this parrot disease recognized? Infected birds gradually lose weight. They die acutely when their glandular stomach ruptures. The two typical characteristics of PDD are therefore gastric dilation and gastric wall thinning. Since there is currently no cure available to vets, treatment is based solely on supportive measures. 6. Polyomavirus, budgies predominantly affected. Polyomaviruses predominantly affect budgies, so they are not a parrot disease strictly speaking. However, vets have also reported cases in some parrot species. They become infected through contact with contaminated feces or feather dust. The viruses then migrate via the blood to the nervous system, skin, and inner organs. How are polyomaviruses recognized and treated? The course and clinical symptoms of a polyomavirus infection depend heavily on the age of the affected parrot. Should the vet have a suspicion, they can directly or indirectly detect the virus through several samples. There is currently no known remedy for polyomavirus, so vets can only relieve the symptoms. 5 common parrot diseases symptoms. 1. Psittacosis. Psittacosis is the most frequent disease discovered in the psittacine or parrot family of birds, and it can be transmitted to people. It is a contagious disease that is transferred by sick birds' excrement or nasal discharge. As birds are extremely mobile vectors with access to detritus and can feed on diseased animals, they can readily be exposed to such diseases. According to U.S. sources, the number of sick humans due to this disease was fewer than 10 in 2010 as a result of modern legislation and regulations governing the pet bird trade. Let's discuss the symptoms that occur in birds when they are suffering from this disease. Small blue diamond, poor appetite. Small blue diamond eye or nose discharge. Small blue diamond diarrhea. Small blue diamond green or yellow droppings. Small blue diamond ruffled appearance. Identifying if your pet is suffering from this disease is not a big deal, as you can easily make out from all these symptoms. Psittacosis treatment is entirely dependent on the sort of symptoms, and while birds can die from the disease in severe cases, they can also shed the bacteria in lesser ones. All you have to do is take proper care of your pet bird and keep an eye on them anytime their health changes. 2. Polyomavirus, which causes major harm to the bird's body parts and organs, is another lethal virus that is most common in parrots. Young birds are particularly at risk, and as they grow older, they develop some kind of immunity to the disease. Although the virus may be present in your bird, it normally takes 10 to 14 days for all of the symptoms to appear, and once they do, the bird only has 1 to 2 days left. It is mainly contracted by close contact with diseased birds. Infected feces, feather dust, nest boxes, incubators, and even an infected parent can transfer the virus onto the chick. Some symptoms of polyomavirus are listed below. Small blue diamond swelling in the abdomen. Small blue diamond weight loss. Small blue diamond dehydration. Small blue diamond depression. Small blue diamond difficulty in breathing. 3. Pashiko's disease. This is a highly contagious disease caused by the herpes virus that affects psittacine species of birds, popularly known as parrots. Pashiko's disease affects Amazon parrots, African gray parrots, macaws, conures, and cockatoos. This sickness has a significant mortality rate, and the birds frequently die unexpectedly. Contaminated water or food, conjunctival contact, and even inhalation are the most common ways that parrots are exposed to this disease. However, the symptoms do not appear right away. According to accounts, the symptoms take weeks to completely appear, and the virus's propagation is aided by the environment and living conditions. The following are some of the most common symptoms associated with the presence of the herpes virus. Small blue diamond moist droppings. Small blue diamond watery, yellowish to greenish discoloration of urates and feces. Small blue diamond mucoid discharge from nostrils. Small blue diamond regulation of clear sanguineous fluids. Small blue diamond losing interest in eating and in day-to-day activities. Small blue diamond being lethargy. Small blue diamond extreme depression hours before its death. In most circumstances, none of these symptoms will appear, and the condition will only be discovered after death. Many other symptoms, on the other hand, can be easily diagnosed with the use of laboratory tests. 4. Giardia. Giardia, often known as the gastrointestinal parasite, is a common disease in birds. As the name implies, this condition causes numerous issues in the stomach and intestines of birds, as well as affecting the regular working of the organs. Giardia is a type of single-celled bacterium that lives in the intestines. Cockatiels, budgerigars, macaws, cockatoos, and other parrots are particularly susceptible to these parasites. Consumption of contaminated food is the most common way for this virus to spread. Some of the common symptoms of the giardiasis infection include small blue diamond malnutrition, small blue diamond weight shedding, small blue diamond itching, small blue diamond overplucking of the skin, small blue diamond inadequate nutrition uptakes, small blue diamond diarrhea. 5. Bacterial diseases. Due to lack of hygiene and stress, birds often develop various kinds of bacterial diseases, but some birds tend to develop genetic immunity. Bacterial diseases are highly common in birds and they become sick due to the infection. Some symptoms of bacterial diseases are small blue diamond weight loss, small blue diamond illness, small blue diamond loss of appetite, small blue diamond difficulty in breathing, small blue diamond nasal discharge. Environmental stress, emotional stress, and ill health due to other infections or diseases all contribute to a bird's immunity being lowered. Final thoughts. Because of their wings and color, parrots are unquestionably one of the most appealing birds. However, beauty only lasts as long as you are healthy, and the same is true for birds. When a parrot has a sickness, there are various indicators that can help you determine whether they are healthy or not, such as a change in behavior from normal, fluffed feathers, weight changes, and a reluctance to move. Among the 5 common parrot diseases symptoms that afflict them the most, including psittacosis, which has symptoms including a loss of appetite, breathing problems, depression, and droppings that are watery and green, and excessive discharge from the eyes and nose. Swollen abdomen, loss of appetite, vomiting or diarrhea, weight loss, and dehydration are the symptoms of polyomavirus. Pashiko syndrome has tremors, lethargy, sinusitis, and anorexia as symptoms. The 4th is giardia, which causes diarrhea, dry itchy skin, weight loss, and other symptoms. The last one is bacterial infection. If you notice any of the following symptoms in your birds, you should get medical advice from a veterinarian so that the situation may be resolved. Toxins. Poisons may be ingested or inhaled. Swallowed agents include avocado, causing gastroenteritis and nervous signs, and heavy metals such as zinc and lead causing hemorrhagic enteritis, and nervous signs. The inquisitive nature of most parrots means that they will often nibble at things that should not concern them, and make themselves ill as a result. Continual vigilance is required on the part of the owner to ensure that household items like electric cables, small metal objects, or other potentially dangerous items are kept out of the bird's reach. Toxic houseplants or outdoor vegetation accessible to aviary birds may also be a problem. TV remote. Cockatoo destroying a TV remote controller, not a safe toy. The unique anatomy of the parrot's respiratory system makes it very sensitive to inhaled gases. Carbon monoxide, coal gas, cigarette or bonfire smoke, aerosol sprays, and paint fumes will all cause problems to birds. There may be transient coughing or choking, asthmatic attacks, or chronic respiratory disease with prolonged exposure. Perhaps the most toxic and dramatic are the fumes given off by overheated non-stick pan linings or cooking oil. Such occurrences will kill a parrot within minutes. Tumors. Many types of tumor are found in parrots, but budgerigars are perhaps the most susceptible. These may be internal, and would include growths in the liver, ovary or testes, or occasionally other organs. Tumors affecting the gonads will often manifest as lameness, as well as a swollen abdomen. Alternatively, they may be external, affecting the skin, feathers, or preen gland. Most skin tumors are benign accumulations of fat, or cholesterol, but others may be aggressive skin cancers or localized nodular fibrous tumors. Others may be virus-linked. Preen gland tumor xanthoma. Left, tumor of preen gland in a budgerigar. Right, xanthoma in a cockatiel. Virus diseases. There are several of these infectious, intracellular organisms that will cause specific diseases in parrots. Some that are found in other birds, like avian influenza, are infrequently encountered in parrots. Pox virus is occasionally seen in macaws, producing crusty lesions on the facial skin. Adenoviruses generally result in liver disease, and particularly affect lovebirds. Paramyxovirus will affect the nervous systems of small grass parakeets, manifesting as head tilt and circling, with loss of balance. This virus occurs commonly in pigeons and doves, and these birds therefore may be a source of infection to parakeets. A vaccine produced to protect pigeons has been used with some success in vulnerable and valuable flocks of parakeets. In poultry, many tumors are virus-induced, and it is quite likely that similar viruses of the leucosis group are responsible for tumors in budgerigars and cockatiels. Papillomavirus certainly produces wart-like growths in the cloaca and oral cavity. A common herpes virus causes an acute, rapidly fatal, hepatitis in parrots, and is known as Pashiko's disease. This is most frequently encountered in recently imported birds in quarantine. It will spread rapidly and will wipe out a high percentage of the group in a few days. Polyomavirus generally afflicts young parrots and will result in sudden death, with pale skin and pinpoint hemorrhages visible in the skin and around abdominal organs. Any birds that do survive generally develop abnormal stunted feathering. Circovirus is the cause of the highly unpleasant cytosine beak and feather disease. This virus attacks young growing feather and beak tissue in fledgling birds, as well as damaging their immune system, so they have no resistance to other diseases. In budgerigars it is known as French mold, and although most infected birds will die, some will survive but with damaged wing and tail feathers, so they can never fly and are hence known as runners. In most other parrots, infection is almost invariably fatal. The course of the disease varies with the age at infection and the infective dose of virus. Very young chicks will die quickly, often dropping feathers by the handful first. Older birds will develop characteristic feather deformities or discolorations. White and black birds like the Vasa parrot or pink and African greys. See also cytosine beak and feather disease. Avian bornovirus is responsible for another devastating disease with a prolonged incubation period. Macaw wasting disease, or proventricular dilatation disease or proventricular dilatation syndrome. This virus is similar in its effects to Key-Gaskell syndrome in cats or grass sickness in horses. Initial infection causes mild transient diarrhea, from which most individuals recover. In a small percentage, there is damage to the nerves controlling the stomach, so that this organ becomes stretched, thin-walled and bloated. Digestive efficiency is impaired, so affected birds will eat well but lose weight, commonly vomit, and will pass undigested food items in their droppings. Some birds will also show nervous signs such as tremors or incoordination. Like PBFD, the incubation period can be many months, making the source of infection difficult to define. It is also currently incurable, although isolated pet birds may be maintained by feeding soft foods and giving non-steroidal anti-inflammatory drugs. All these viral diseases have no specific treatments, since antibiotics will have no effect. Thus their control depends on vaccination, hygiene and disinfection, and quarantine. It is important never to mix newly acquired birds with existing stock immediately. They should be kept in isolation for a period of quarantine to allow dormant infections to show themselves. This period should be from 10-30 days, the longer the better. Most infectious agents will show up in this time, but as mentioned with PBFD and PDD, some viruses will incubate for many months. However, parrots can be tested during the quarantine period for the presence of these viruses. Such control measures apply equally to other infectious diseases. Psittacosis. Psittacosis is a common and potentially serious disease occurring in both the birds that we keep and the humans that keep them, and is described in far more detail in its own section, Psittacosis. Bacterial diseases. Because of the open nature of a parrot's anatomy, with no muscular diaphragm to separate the chest cavity from the abdomen, and free communication between the air sac system and the hollow bones, most introduced infectious organisms may start in one organ like the lung or the stomach, but will rapidly spread around the body to produce a septicemia. The list of possible bacteria is long, and precise identification would depend upon laboratory culture and analysis. Such tests can include antibiotic sensitivity, revealing which antibacterial drug should theoretically kill the organism. The choice will be tempered by cost, availability, possible side effects, and the practicalities of its administration to the patient. Drugs given in drinking water are often not taken in sufficient dose by the bird. Palatable and food medications are few and far between, while the daily administration of drops, tablets, or injections is stressful for the parrot and the owner. Common bacteria include the enteric food poisoning organisms Salmonella and E. coli, Klebsiella, Yersinia, Mycobacteria, and many others. Because of the range of organs involved, infected birds will generally show the generic sick parrot appearance, being fluffed up, subdued, inappetite, and with loose, discolored droppings. Fungal diseases. Yeast organisms like Candida albicans cause disease of the digestive system, often following antibiotic usage or damage to the immune system. Hand-reared chicks are commonly affected, with thrush appearing as yellow plaques in the mouth, or infections of the crop, with thickenings of the lining with creamy yellow deposits. Older parrots may have smelly, pasty diarrhea, and stained impression smears of their droppings will show large quantities of yeast organisms. Aspergillosis is caused by the inhalation of fungal spores that grow inside the bird as a fungal plaque in the lungs or on the air sacs. Such spores are present continually in the air we breathe. Small numbers of spores are eliminated by protective white blood cells in the body. Active infection arises either when large quantities are inhaled, such as when mold grows on food or droppings left in the cage or aviary, or the parrot cracks open a stale nut, or if the bird's immune system is weakened by poor diet or virus infection. It is very common to find aspergillosis in young African gray parrots. Many of these birds turn out to be infected with PBFD virus. The fungus causes disease in two ways. Firstly, the physical presence of the mold growth will affect the bird's breathing. Fungal colonies developing at the base of the trachea result in an acute, choking problem, with rapid death without emergency treatment. Growth in the lungs will lead to pneumonia, while that in the air sacs will cause more insidious, gradual breathing problems. Meanwhile, the fungal colony releases a toxin into the bloodstream that attacks the liver, causing death by toxic hepatitis. 2 articles were published in the Parrot Society magazine in 2021, describing this unpleasant disease and its devastating effects in more detail. The first describes the science of the infection and its signs and effects. Aspergillosis 1, the science, while the second article describes the emotional effects on the owners of affected birds. Aspergillosis 2, the emotion. Megabacterium is an organism something between a bacterium and a fungus, which is treated with a combination of antibiotics and antifungal drugs. Its most common manifestation is as a chronic digestive disease in budgerigars, with vomiting and weight loss. Macrorhabdus. Macrorhabdus ornithogaster staining dark purple in a fecal sample. Parasites. These may be external or internal, and are generally larger organisms living on body tissues of their host. Internal parasites include protozoa and coccidia, although these tend to be less of a problem in parrots than in poultry and other bird species. The exception is Trichomonas, which causes canker in pigeons or frounce in birds of prey. This organism will also frequently infect budgerigars, resulting in chronic vomiting and weight loss, similar to megabacteriosis. Tapeworms are seen occasionally in recently imported African gray parrots or cockatoos, and will appear protruding from the vent as a creamy gray wriggly ribbon 2-3 mm across. Roundworms are far more common, especially in ground-feeding birds like grass parakeets and some cockatoos. They may be passed in the droppings, and appear as 2-3 cm long, pointed at both ends. Roundworms. Ascarid roundworms in cockatoo droppings. External parasites include ticks, lice, and mites. Ticks live for much of the year resting in vegetation, but will climb to find a suitable host when they require a meal of blood. They are found particularly in areas where there are sheep, rabbits, or hedgehogs, and most vulnerable are parrots and outside aviaries with overhanging plants. The ticks will attach to the unwary bird by way of their sharp, barbed mouthparts and suck blood over the next few days, swelling in size as they do. Once sated, they will drop off, but they inject an anticoagulant into the puncture site, Some birds will react to this substance and will be found suddenly dead with no previous signs of illness. The tick may or may not still be attached. Control of this problem depends on the removal of overgrown vegetation from around the flight. Lice and mites living on the feathers and skin are far less common in parrots than they are in species like canaries, poultry, and pigeons. However, quill mites that live within the feather may be a cause of some feather plucking problems. The most common external parasite found in parrots is the scaly face, leg mite seen Emodocoptes, and this is most frequently encountered in budgerigars. This is similar to the mange mites of cats, dogs, and foxes, and burrows into the skin, resulting in crusty, thickened skin in affected areas. Historic treatments include the use of liquid paraffin or petroleum jelly, which will have the effect of suffocating the mites, or benzyl benzoate applications, which gradually will kill the parasite. However, these treatments require prolonged, repeated applications to achieve success. Current medication is by application of the parasiticide ivermectin. This is absorbed through the bird's skin and kills the mite via the bloodstream. Generally 2 applications 10-14 days apart will be successful, although in severe cases a third may be required. The infestation appears not to be highly contagious, only a few individuals in a flock may show signs. There appears to be a need for immunosuppression in the bird before the mite can multiply sufficiently to show clinical disease. Scaly face. Severe scaly face infestation in a budgerigar. First aid care. It should by now be obvious that there are many disease conditions that can potentially affect your birds. Precise diagnosis and specific treatment is the province of an experienced avian veterinarian, but several common-sense precautions may be taken to avoid such problems. These include quarantining new arrivals, as mentioned above, and not mixing new birds immediately with existing stock. Good hygiene and regular disinfection of food and water bowls, perches, nest boxes, toys, and cages are essential. The control of vermin and the secure storage of good quality food in airtight containers are important. Selection of sound, healthy stock in the first place is obviously wise, and the feeding of a top-quality, well-balanced diet, suited to the species is paramount. Finally, regular observation of your birds, to identify subtle changes in their normal behavior and attitude, will enable you to spot problems before they become too advanced. If you do consider that you have a sick bird, then there are 3 useful things to do. The first is isolation. Separate the bird from any companions, and bring it into a small indoor cage. This will allow you more closely to observe it and monitor its progress, more easily to administer any medication that may be required, hopefully to avoid further spread of the disease should it be contagious, and to avoid bullying of the sick bird's other members of its group. Secondly, warmth. Birds have a high metabolic rate, and will expend a lot of energy just to maintain their body temperature. Supplying external warmth will aid the bird's recovery by enabling it to divert energy to getting better. This may simply mean bringing an aviary bird indoors. Alternatively, use a heat pad, a hot water bottle, an airing cupboard, or place the cage near a radiator. It may be worth investing in a hospital cage, or an infrared heat lamp. The third important home therapy is fluids. Sick birds will dehydrate rapidly, especially if they have vomiting or diarrhea. Encouraging their fluid intake by sweetening their drinking water with honey, sugar, glucose, or fruit juices will prove invaluable. Better still are proprietary oral electrolyte solutions. If the parrot will not drink voluntarily, these must be administered by spoon, dropper, syringe, or crop tube. Resist the temptation to reach for the old pot of antibiotic powder at the back of the cupboard, or worse still, use some prescribed for a friend's birds. As I hope by now I have made clear, antibiotics are effective only against bacterial infections, which account for about 25% of sick birds. You will do far better to give a probiotic, as well as the fluids and electrolytes, until you have obtained a proper diagnosis. This will have the effect of boosting your bird's immune system and aiding its digestion, while it recovers. Birds can be enjoyable pets and loyal companions, but it can be distressing when your feathered friend shows signs of illness and isn't its usual chirpy self. Recognizing common pet bird diseases and knowing the best solutions for these conditions can help you be sure your bird leads a healthy and happy life. Most common pet bird diseases and how to help. There is a wide range of diseases that can infect pet birds, but different bird species have different susceptibilities to various infections. The most common conditions that can affect a wide range of popular pet birds include parrot wasting syndrome, also called macaw wasting syndrome or proventricular dilatation disease. This illness is characterized by weight loss, vomiting, and a swollen crop, and may even present with seizures or depression-like symptoms. Treatment includes providing a stress-free environment for the bird and a special diet, and severe cases may require non-steroidal anti-inflammatory drugs. Parrot fever. This bacterial infection is also called psittacosis and is highly contagious among pet birds. Labored breathing, lethargy, and eye infections are common symptoms, and antibiotics are essential for curing the illness. Psittacine beak and feather disease. This disease affects all parrot species and is particularly infectious among young parrots or birds that already have health difficulties. Symptoms include feather loss and poor plumage development, as well as abnormal beak growth. A skin or feather biopsy is usually needed to confirm the diagnosis, and while there is no current treatment, vaccines are under development that have shown promise to prevent this disease. Polyomavirus. This viral infection affects a bird's plumage and can cause abnormal feather growth, or lack of wing flight feather or tail feather development entirely. Other symptoms include appetite loss, diarrhea, and paralysis. This disease progresses very quickly, and there are no effective treatments at this time. Candidiasis. A bird with candidiasis, also known as thrush, will typically show white lesions in the mouth and throat and may also be vomiting. Appetite loss is quite common due to the difficulty in swallowing. This illness is caused by a type of yeast infection, and is most often treated with antifungal medication and keeping a cleaner environment, particularly food and water dishes. Giardiosis. This disease is recognized by the combination of diarrhea or vomiting, weight loss, and dry, itching skin, which may cause birds to nibble at or pluck their feathers. There are drug treatments for this illness, and it is important that pet birds are not overcrowded and they have clean water to prevent the spread of the disease. Goiters. A goiter is an enlargement of the thyroid gland due to iodine deficiency, and in addition to a swollen throat, pet birds with goiters may be reluctant to feed because of difficulty swallowing, and their voices may change. Vomiting, weight loss, and wheezing are other common symptoms. Dietary adjustments can help eliminate and prevent goiters, and iodine supplements may be necessary in severe cases. Hashimoto's disease. This disease is particularly common in parrot species and can cause severe liver and kidney damage. Other symptoms include diarrhea, lethargy, discolored feces, and tremors or trembling. While this illness can be difficult to treat, there is medication available to relieve the symptoms. These are just a few of the diseases that can affect pet birds, and it is important that bird owners carefully research other illnesses and health conditions that may be a problem for their specific pet bird species. Always seek veterinary care. Because many pet bird diseases show similar symptoms, and because many birds are clever at hiding signs of discomfort, until an illness has progressed drastically, it is important to always be vigilant about your pet bird's health and seek expert veterinary care right away if problems are noticed. An avian veterinarian can perform blood tests, biopsies, and other procedures to accurately diagnose different diseases, even if not all symptoms are apparent. Once the illness is diagnosed, proper treatment can start and your pet bird can get back to health as quickly and easily as possible. Parrot diseases. Parrots are generally robust birds that live long and happy lives. There are, however, many ailments that can befall them, most of them being like the common cold, briefly debilitating, but soon gone. The key is to get an accurate diagnosis as early as possible and act accordingly on an avian vet's advice. Fisher's lovebird. Some birds may look as healthy as this Fisher's lovebird in the early stages of disease. Note, the following sections list some of the commoner diseases, but are by no means exhaustive. Aspergillus. This is a fungal infection of parrots' air sacs and lungs, usually contracted in damp or dirty environments where the fungus can bloom. The symptoms are breathing difficulties, with an audible wheezing, accompanied by fluffed-up feathers and a generally poorly appearance. There is sometimes discharge from the nostrils. Avian gastric yeast infection. Also known as macrobacteriosis or megabacteriosis, this highly contagious infection is caused by a mixture of yeast infection and secondary bacterial infection. It affects budgies mainly. It is difficult to spot in the early stages, incubating with no outward sign of trouble. The first outward sign is weight loss, as algae impedes digestion. There will be undigested food in the droppings, and birds may vomit food and mucus. Yellow-crowned Amazon head. Yellow-crowned Amazon in full health. Candida virus, or candidiasis. This is a yeast infection, the same one that infects humans. It blooms in the parrot's crop or digestive tract, and will not be transmitted to humans via birds unless you allow them to kiss you. Infected birds will be listless and may have loose droppings. As these are symptoms of many kinds of ailment, a trip to the vet for diagnosis is essential. Candida is easily treatable. Colds, sneezes. Parrots can catch colds, and the symptoms are similar: runny noses, swollen eyes, wheezing, and sneezing. In parrots, however, the condition can lead to rapid decline, and a vet's administrations will be required. Macaw wasting syndrome, or preventricular dilatation syndrome. This is a viral infection that causes stomach problems. Infected birds will have an increased appetite, but will weight loss and pass undigested food in their droppings. There may be vomiting too. There is a rapid decline in health, ending in death if not treated. It is not restricted to macaws, but it cannot be transmitted to humans. Prevention via regular and thorough cage cleaning is the best approach, as an infected bird is unlikely to survive, and a vet will usually recommend euthanasia. Scarlet macaw head. Macaws that fall victim to wasting syndrome are unlikely to pull through. Nutritional deficiencies. The symptoms of a poor diet are varied, from feather loss and beak malformation to behavioral problems, and a rapid decline into death. All pet birds need their recommended daily doses of vitamins and minerals, as well as protein, fatty acids, and various micronutrients. A balanced diet and access to a mineral block should supply all these needs. A lack of calcium will lead to hypocalcemia. This causes particular problems in female birds if they are laying eggs. They may become egg-bound, or the egg might be soft-shelled and unviable. An affected bird may become infertile. In order to absorb calcium, the parrot needs a good vitamin supply too. A healthy diet and mineral block should provide all the bird needs. Overweight cockatiel. This cockatiel needs to lose some weight to attain full health. Allied to nutritional problems are obesity-related issues. This is always due to an excess of fats and sugars in the bird's diet. Feeding each species with the specific requirements for that species is the answer. Although things can become a bit more complicated in aviaries where one bird devours the whole cage supply of a favorite fatty food, or acquires a taste for something not normally included in that species' diet, keeping an eye on your bird's behavior will give you clues to what's going on. And in worst-case scenarios, you might have to isolate the greedy one. Divided by p greater than. Parrot fever or psittacosis. This is the worst thing that can strike your aviary. It spreads very quickly, and most of the affected birds will die. The organism responsible is Chlamydophila psittaci, a species of the chlamydia family of bacteria. In birds, the disease is called ornithosis, and in parrots has the specific name psittacosis. One of the chief problems is that it can survive in the environment and soil or droppings. Keeping a clean cage or birdhouse is therefore essential, and the best preventative treatment. If infection strikes, disinfecting the environment is necessary. Suitable treatments are readily available from vets. The fact is, the world is full of chlamydia bacteria. Around 1% of the wild bird population is thought to carry it, and its presence in their droppings is the usual origin of an outbreak in an aviary. Many of these wild birds are carriers, with no external symptoms of the disease. It tends to flare up under stress, other illness, drought, poor food supply, quarantine or rehousing, for example, and spreads via the air through feather and fecal dust. An infected bird will have infected droppings up to 2 weeks before showing signs of illness. Quarantine of any new bird is therefore vital, for at least 45 days. Birds like these wild Mayer's parrots can be carriers of various diseases. Birds like these wild Mayer's parrots can be carriers of parrot disease. Symptoms vary according to species. Conjunctivitis and other signs of sore or swollen eyes is a clue. If the problem is psittacosis, the condition won't respond to conventional treatments. In general, the image of being sick as a parrot sums up the symptoms. Normally lively birds become withdrawn, with ruffled feathers, loss of appetite, rapid weight loss, loose droppings, and breathing problems. Some birds decline very quickly and die within 24 hours. If a bird shows any of these symptoms, isolate it immediately and consult a vet. Diagnosis through tests is surprisingly difficult, as the chlamydia bacteria are commonly present in so many birds in a dormant state. One online advice site for parrots makes the grim observation: post-mortem examination is perhaps the most reliable method of achieving a positive diagnosis, but an autopsy will at least let you know if your other birds are in danger. A vet may recommend putting an infected parrot to sleep, due to the disease being so difficult to eliminate, and also the potential threat to human health. This is always a dilemma, but human health considerations must take priority. Polyoma. This virus is a major cause for concern in baby parrots, causing a high percentage of deaths. In older birds, the virus is treatable with antibiotics. Symptoms in adult birds are intestinal, loose droppings, and vomiting. Younger birds will have swollen stomachs, shakiness, and feather problems. Polyoma is not transmittable to humans. Birds can be vaccinated against it, far and away the surest prevention. Psittacine beak and feather disease. This is an incurable condition caused by psittacine circovirus. It attacks feather follicles, causing feathers to become stunted and deformed. Over time they will drop out. The disease is not life-threatening in itself, but can cause the immune system to become depressed, making the bird susceptible to secondary infection. An affected bird will need additional warmth, and will look like a giant, reptilian parrot chick. Cockatoos and cockatiels are particularly susceptible. Unfortunately, there is still no cure. Sauerkraut. The crop is part of a bird's digestive system, and it can become infected by bacteria or candida yeasts. Sauerkraut is a catch-all for crop-related problems. The symptoms will be a swollen crop area, regurgitation, and listlessness. A vet's expertise will be required to pinpoint the problem and offer a cure. Ulcerative dermatitis. This is a skin complaint involving ulcerated skin. It may be due to previous wounds or breakages, diabetes, or intestinal parasites. The ulcers are caused by the uncomfortable parrot pecking its own skin. The sores become itchy, creating a vicious circle. Once the wound is open, bacterial or fungal infections can cause problems. Cleaning and vet-prescribed antibiotics are the cure. Parrots may have to wear a collar while the wound heals. Customer images. Upload your photo. Upload your photo. Comments. Maryland, the 24th of August 2021. I have an Eclectus parrot 23 years old. He just started falling off his perch and his toes constricted for anywhere from 3 minutes to 10 minutes and laying on the bottom of the cage looking very confused. He allowed me to pet and talk softly to him. He gets up and tries to climb the cage to his perch with difficulty at first, then gaining strength. This has happened at least 3 times in the past couple weeks. What can I do? Is it nutritional? I give him a diet of fruits, vegetables, and his pellets. Treats are seed balls and millet. Occasionally a peanut, walnut, almond, or pistachio. Maywish, the 31st of May 2021. I have a green parrot 3 months old. He is having swollen eyes with cough, sneeze, and loss of appetite. Kindly suggest some medicine. Akshit, the 3rd of May 2021. I have a Alexander parrot 6 weeks old. He was perfectly fine till yesterday. Now he got one big boil, which is yellow in color, on his forehead. What is this disease and how to treat it? Sohail, the 27th of May 2020. I have raw parrot of 5-month age. Since last week he has racily, tumor under his wings. He is so much weak since 10 days. PLZ advice some medicine to remove racily. Animesh, the 11th of April 2020. Have a green Alexander parrot. He is 1 year old and usually very active, but from yesterday he didn't eating anything and his is not functioning well. His feathers is also fluffy at this time. He is not able to walk long properly. He is not eating anything and just close his eyes and stand in one place. Please advise any house medicine for him as all market is close due to lockdown. Common conditions of pet birds. By Lori Hess, DVM. Rick Axelson, DVM. General information. Pet birds often become ill when they are not cared for or fed appropriately. While most avian diseases can affect every species, some species are more prone to develop certain conditions. By being familiar with various conditions that commonly affect a certain species, your veterinarian is able to formulate a diagnostic and treatment protocol resulting in a correct diagnosis and cure for your bird's illness. While it is impossible to list every possible disease that may afflict your bird, the following discussion will familiarize you with some common health conditions your pet bird may encounter. If the signs of these health conditions are noticed, contact your veterinarian right away. Budgerigars. Budgerigars, or budgies, commonly develop cancerous tumors in their kidneys and reproductive organs. Kidney, ovarian, and testicular tumors often cause a unilateral lameness that owners often mistake for an injured leg. Goiter also can occur in budgies, especially when they are on all seed diets. Seed contains very low levels of iodine that is required by the thyroid gland to function properly. Therefore, the gland swells to try to extract all the iron it can from the seeds. Budgies afflicted with this condition are often overweight and have a squeaky voice, or regurgitate when they eat as a result of the enlarged thyroid gland pressing on the esophagus. Another condition commonly seen in budgies, especially when they are in close contact with other budgies in pet stores, is psittacosis. It may be carried by budgies without them showing any clinical signs, or infected birds may show respiratory signs or a swollen abdomen from liver enlargement. Since many owners incorrectly feed all seed, high-fat diets to their budgies, obesity is common in these birds. Hepatic lipidosis is a problem that often results in causes death. This species also is predisposed to poor diet-related tumors called lipomas and xanthomas that may be found on the wings and ventral abdomen. Lipomas appear as pockets of soft, white, movable fat, while xanthomas are typically firm, fixed, and yellow-orange. Reproductive problems are very common in pet birds, as well. Egg binding is seen often in pet budgerigars, even those housed individually without a mate, that are still capable of laying eggs. Birds often become egg-bound when they are eating diets high in seed that lack calcium and vitamin D, which are critical in the formation and laying of eggs. Cockatiels. Cockatiels, like budgies, are commonly afflicted with respiratory disease caused by the bacteria Chlamydophilus psittaci. Like budgies, cockatiels can carry this organism without any signs, shedding it in their stool and respiratory tract secretions to other birds, or they may develop respiratory signs, weakness, and enlarged livers. Another organism that commonly affects cockatiels is the internal parasite, Giardia. Birds infected with Giardia may have diarrhea and be very itchy, violently attacking themselves, especially under the wings. Another disease more commonly seen in cockatiels is gastrointestinal yeast infection with Candida organisms. Birds with yeast often regurgitate, lose weight, and have diarrhea and decreased appetite. Birds on all seed diets often become obese and develop fatty liver disease, which can lead to death. Reproductive problems are even more common in cockatiels than in budgies, even in individually housed pets, and include egg binding, soft shell to shell-less eggs, oviduct prolapse, and reproductive tumors. Canaries. Canaries have several genetic-based conditions. Feather cysts, which require surgical removal, frequently occur in canaries. Cataracts also are not uncommon. In addition, baldness of the head of certain male canaries also occurs. An unusual form of nematocytic mange called tasselfoot occurs frequently in these popular birds, in which mites cause excessive buildup of crust on the skin over the feet, making the feet look like there are tassels hanging off of them. Air sac mites that infect the trachea and air sacs commonly contribute to respiratory disease in canaries. Affected canaries breathe quickly, often with open mouths. In addition, owners who provide their canaries with nesting material made of fine thread often unknowingly cause a problem for their birds. The fine thread can wrap around a toe or foot, impairing the blood circulation and ultimately causing necrosis of the affected toe or foot. With extreme tissue damage, the toe or foot may need to be amputated. Poxvirus causes crusty lesions on the unfeathered skin in canaries and may affect the respiratory system, ultimately causing death. As with other small birds, reproductive problems, such as egg binding, are seen in canaries. Finches. Similar to canaries, finches often have air sac mites, leading to severe respiratory disease. In addition, as in canaries, fine thread used as nesting material can wrap around the toes and legs of finches, impairing circulation to the limbs and ultimately requiring amputation of affected tissue. When stressed from overcrowding, finches will often pick feathers off each other, especially around their heads and faces. Finally, these small birds, especially if they are fed all-seed diets deficient in calcium and vitamin D essential for egg production and laying, will often develop egg binding, which can rapidly result in death if not treated early. Canures. A strange bleeding syndrome of unknown cause has been reported to occur in canures. When they are injured or when they have blood drawn, they bleed excessively. Luckily, this syndrome can be treated effectively if caught early. Feather picking is seen with some frequency in pet canures when they are stressed or overcrowded. Nande and Patagonian canures may carry a herpes virus without showing any clinical signs. This herpes virus causes an illness called Pashiko's disease in other bird species, particularly Amazon parrots and cockatoos. In these species, Pashiko's disease typically causes sudden death. Therefore, canures should not be housed with other bird species. Lovebirds. Like other smaller bird species, lovebirds may be affected with chlamydiosis that typically causes respiratory signs, weakness, liver problems, and death. Lovebirds also commonly develop gastrointestinal tract yeast infections caused from the yeast candida. Various infectious causes of feather loss occur in lovebirds, including skin infection with yeast and bacteria, particularly inside the wings. Epilepsy is occasionally seen in lovebirds. Reproductive problems, such as egg binding, seen frequently in other small birds, also occur with some frequency in lovebirds. African gray parrots. These extremely intelligent, often high-strung birds frequently develop psychologically based causes of feather picking as a result of boredom or loneliness. They will also feather pick as a result of sexual frustration from not breeding. A potentially fatal syndrome occurs in African greys on all seed diets in which they develop low blood calcium levels resulting in seizures. Aspergillosis, a potentially fatal fungal infection, is often seen in African greys. The signs include difficulty breathing, sneezing, lethargy, weakness, and weight loss. Bacterial infections of the respiratory tract may cause similar signs as aspergillosis. Cancer is seen with some frequency in this species, as they are long-lived. Although uncommon these days, beak and feather disease virus may occur in young African greys, and is quickly fatal as a result of suppression of the bone marrow. Amazon parrots. Amazons are commonly afflicted with upper respiratory diseases, many of which result from vitamin A deficiency associated with an all-seed diet. Cloacal papillomas commonly affect older Amazon parrots and may also appear in their mouths. Amazons may feather pick, especially their wings and legs, as a result of psychological stress and sexual frustration. Amazons commonly exhibit mating season aggression towards their owners. Some of these birds become too aggressive to handle and are given away to shelters. A syndrome of unknown cause, called Amazon foot necrosis syndrome, occurs in Amazon parrots. With this syndrome, parrots violently mutilate the skin on their legs and feet, causing excess bleeding and tissue damage. Some Amazon parrots develop epilepsy. Like African gray parrots, Amazon parrots are long-lived and as a result develop cancer in various organs. Moreover, like most birds on high-fat, all-seed diets, Amazons commonly develop obesity, hepatic lipidosis, atherosclerosis, stroke, and heart disease. Macaws. Macaws were the first species to develop an ultimately fatal disease, preventricular dilatation syndrome, which causes chronic and progressive weight loss, regurgitation, and in some birds, ultimately death. This syndrome is believed to be an autoimmune disease associated with a viral infection called Bornavirus. No one yet understands the complete cause of disease, as many bird species are infected with Bornavirus and are not clinically affected. Chlamydiosis also occurs in macaws, causing respiratory signs and liver disease. Oral and cloacal papillomatosis also occurs more frequently in older macaws. Psychologically based feather picking often occurs in the larger species of birds that are tightly bonded to their owners. Macaws are no exception. They become frustrated because they are bonded to, but not mating with, their human flock mates. Regression to juvenile behavior may be a sign of illness in sick macaws, especially those with gastrointestinal diseases. Cockatoos. Cockatoos, like other large birds, often develop psychologically based feather picking that is difficult to treat, particularly because they are so socially needy and require a great deal of attention from their owners. However, other problems, such as infection of skin with bacteria and yeast, may also cause feather loss. For this reason, any feather loss should be thoroughly investigated by your veterinarian. Like macaws, regression to juvenile behavior is often seen in cockatoos and may be a very early sign of severe illness in this species. Cloacal prolapse, seen most often in sexually mature males, occurs frequently in cockatoos. Lipomas are commonly seen in rose-breasted cockatoos who have a tendency to become obese. Contributors: Lori Hess, DVM, Rick Axelson, DVM. Go to our Facebook page, go to our Twitter page, go to our LinkedIn page. Keywords: Care Club Hospital Full Color. Find a hospital. Locate a hospital near you. Learn more. Related articles. Insight image. Recognizing the signs of illness in pet birds. In the wild, a bird will endeavor to uphold a strong appearance when sick. This is called survival of the fittest. By the time a pet bird actually shows an owner that it is unwell, it has likely been sick for some time. Many things contribute to ill health. This handout provides bird owners a categorized list of signs that should alert them that their bird is sick. Insight image. Chlamydophilosis in birds. Chlamydophilosis, also called psittacosis, chlamydiosis, or parrot fever, is a reasonably common disease of birds. It can occur in any bird but is especially common in cockatiels, Amazon parrots, and budgerigars. Insight image. Nursing care for sick pet birds. While sick birds can occasionally be treated by their owners at home, any bird showing signs of illness should be examined by a veterinarian. Birds that are gravely ill will require hospitalization, while those that are still eating or that are only mildly affected may be treated by their owners under their veterinarian's direction. For your bird to have a good chance of recovery, medication must be administered. What is parrot fever? Parrot fever is a rare infection caused by Chlamydia psittaci, a specific type of bacteria. The infection is also known as parrot disease and psittacosis. According to the Centers for Disease Control and Prevention trusted source, the United States has seen fewer than 10 human cases of parrot fever each year since 2010. However, many cases may be undiagnosed or unreported because the symptoms are similar to those of other illnesses. As the name suggests, the disease is acquired from birds. Parrots are not the only possible culprits, however. Other wild and pet birds may also carry the infection and pass it to humans. Parrot fever has been reported in countries including Argentina, Australia, and England. It may be found anywhere birds are kept as pets or in large confined populations. It's more common in tropical environments. Contracting parrot fever. In most cases, humans catch parrot fever from birds, including parrots, chickens, turkeys, pigeons, parakeets, cockatiels, ducks. You can catch parrot fever by handling an infected bird or breathing in fine particles of its urine, feces, or other bodily excretions. You may also become infected if the bird bites you or kisses you by touching its beak to your mouth. Catching the disease from an infected person is also possible, but very rare. This may occur when you inhale the fine droplets that are sprayed into the air when the sick person coughs. Recognizing a bird with parrot fever. Infected birds don't necessarily show symptoms. They can also carry the bacteria for months before any outward signs appear. Just because a bird does not look or act sick does not mean that it's not infected. Infected birds may shiver or have difficulty breathing. Other symptoms include discharge from the eyes or nose, diarrhea, discolored droppings in various shades of green, weight loss, lethargy, and sleepiness. The sick bird may eat less or even stop eating completely. Symptoms. In people, this disease typically resembles the flu or pneumonia. Symptoms usually begin approximately 10 days after exposure, but they may take as few as 4 days or as many as 19 days to show up. Parrot fever has many of the symptoms that you might associate with the flu, including fever and chills, nausea and vomiting, muscle and joint pain, diarrhea, weakness, fatigue, cough. Other possible symptoms, which may not seem flu-like, include chest pain, shortness of breath, and sensitivity to light. In rare cases, the disease may cause inflammation of various internal organs. These include the brain, liver, and parts of the heart. It can also lead to decreased lung function and pneumonia. Diseases that have symptoms similar to parrot fever include brucellosis, a bacterial infection that is normally found in livestock, but can be transmitted to humans. Tularemia, a rare disease that can be transmitted to humans via a tick bite, an infected fly, or contact with the infected small mammal itself. Infective endocarditis. Influenza. Tuberculosis. Pneumonia. Q fever, another type of bacterial infection. Diagnosing parrot fever. Since parrot fever is such a rare condition, your doctor may not suspect this disease at first. Be sure to tell your doctor if you have recently been exposed to any potentially sick birds or if you work in a pet shop, veterinarian's office, poultry processing plant, or any other workplace that puts you in contact with birds. To diagnose parrot fever, your doctor will generally perform several tests. Blood and sputum cultures can reveal whether you have the type of bacteria that causes this infection. A chest X-ray can show the pneumonia that is sometimes caused by the disease. Your doctor will order an antibody titer test to see if you have antibodies to the bacteria that causes parrot fever. Antibodies are proteins that the immune system produces when it detects a foreign, harmful substance such as bacteria or a parasite. Changes in the level of antibodies can indicate that you have been infected with the bacteria that causes parrot fever. Learn more. Sputum culture. Treatment. Parrot fever is treated with antibiotics. Tetracycline and doxycycline are two antibiotics that are effective against this disease. However, your doctor may sometimes choose to treat you with other types or classes of antibiotics. Very young children may be treated with azithromycin. After diagnosis, antibiotic treatment typically continues for 10 to 14 days after the fever resolves. Most people who are treated for parrot fever make a full recovery. However, recovery may be slow in people who are older, very young, or who have other health issues. Still, parrot fever rarely causes death in humans who have received proper treatment. Sorry, the video player failed to load. Prevention. If you have pet birds, you can take steps to reduce your chances of getting parrot fever. These include cleaning your birdcage every day and taking good care of your birds to help prevent them from getting sick. Feed your birds properly and give them enough space so they're not crowded together in the cage. If you have more than one cage, make sure the cages are far apart so that feces and other matter can't be transferred between them. The following are other steps you can take to prevent parrot fever. Prevention tips. Buy pet birds from reputable pet shops. Wash your hands regularly after handling birds or bird supplies. Avoid touching a bird's beak to your mouth or nose. Take birds that look sick to the veterinarian. Keep birds in a well-ventilated area. If you acquire a new bird, have it looked at by a veterinarian. It's good to then isolate the bird and monitor it for sickness for at least 30 days before you allow it to contact other birds. If you see a sick or dead bird, you should not touch it. Contact your city's animal control service to remove a dead wild bird. If it's a pet, you should use caution when touching or moving it. Use gloves and a mask to avoid breathing in any bacteria, feather dust, or other debris. You should also disinfect the cage and all equipment the bird has used to prevent infection or reinfection. A history of parrot fever. Late in the year of 1929, Simon S. Martin of Baltimore purchased a parrot for his wife as a Christmas gift. He asked relatives to care for it until Christmas Day. The parrot looked increasingly ill as time passed. By Christmas Day, the bird was dead. Soon after, two relatives who cared for the birds became ill. Lillian, Martin's wife, also became ill. Their doctor had recently read about parrot fever and suspected it was the cause. When the doctor asked the U.S. Public Health Service for medication to treat it, he was told that there was no known treatment. The case was featured in a newspaper, and the fear of parrot fever spread rapidly. The overall number of cases also increased dramatically. This is because doctors began to look for pet birds in the homes and businesses of people with symptoms resembling flu or pneumonia. The American media created a panic about this new mysterious illness, and inaccurate reports of the number of related fatalities only increased this panic. However, the heightened awareness of parrot fever also presented scientists with enough subjects to eventually isolate the germ and find a treatment for it. And find a treatment for it, 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 and find a treatment for it. It's discovered in the psittacine or parrot family of birds, and it can be transmitted to people. It is a contagious disease that is transferred by sick birds' excrement or nasal discharge. As birds are extremely mobile vectors with access to detritus and can feed on diseased animals, they can readily be exposed to such diseases. According to U.S. sources, the number of sick humans due to this disease was fewer than 10 in 2010 as a result of modern legislation and regulations governing the pet bird trade. Let's discuss the symptoms that occur in birds when they are suffering from this disease. Small blue diamond, poor appetite. Small blue diamond eye or nose discharge. Small blue diamond diarrhea. Small blue diamond green or yellow droppings. Small blue diamond ruffled appearance. Identifying if your pet is suffering from this disease is not a big deal, as you can easily make out from all these symptoms. Psittacosis treatment is entirely dependent on the sort of symptoms, and while birds can die from the disease in severe cases, they can also shed the bacteria in lesser ones. All you have to do is take proper care of your pet bird and keep an eye on them anytime their health changes. 2. Polyomavirus, which causes major harm to the bird's body parts and organs, is another lethal virus that is most common in parrots. Young birds are particularly at risk, and as they grow older, they develop some kind of immunity to the disease. Although the virus may be present in your bird, it normally takes 10 to 14 days for all of the symptoms to appear, and once they do, the bird only has 1 to 2 days left. It is mainly contracted by close contact with diseased birds. Infected feces, feather dust, nest boxes, incubators, and even an infected parent can transfer the virus onto the chick. Some symptoms of polyomavirus are listed below. Small blue diamond swelling in the abdomen. Small blue diamond weight loss. Small blue diamond dehydration. Small blue diamond depression. Small blue diamond difficulty in breathing. 3. Pashiko's disease. This is a highly contagious disease caused by the herpes virus that affects psittacine species of birds, popularly known as parrots. Pashiko's disease affects Amazon parrots, African gray parrots, macaws, conures, and cockatoos. This sickness has a significant mortality rate, and the birds frequently die unexpectedly. Contaminated water or food, conjunctival contact, and even inhalation are the most common ways that parrots are exposed to this disease. However, the symptoms do not appear right away. According to accounts, the symptoms take weeks to completely appear, and the virus's propagation is aided by the environment and living conditions. The following are some of the most common symptoms associated with the presence of the herpes virus. Small blue diamond moist droppings. Small blue diamond watery, yellowish to greenish discoloration of urates and feces. Small blue diamond mucoid discharge from nostrils. Small blue diamond regulation of clear sanguineous fluids. Small blue diamond losing interest in eating and in day-to-day activities. Small blue diamond being lethargy. Small blue diamond extreme depression hours before its death. In most circumstances, none of these symptoms will appear, and the condition will only be discovered after death. Many other symptoms, on the other hand, can be easily diagnosed with the use of laboratory tests. 4. Giardia. Giardia, often known as the gastrointestinal parasite, is a common disease in birds. As the name implies, this condition causes numerous issues in the stomach and intestines of birds, as well as affecting the regular working of the organs. Giardia is a type of single-celled bacterium that lives in the intestines. Cockatiels, budgerigars, macaws, cockatoos, and other parrots are particularly susceptible to these parasites. Consumption of contaminated food is the most common way for this virus to spread. Some of the common symptoms of the Giardiasis infection include small blue diamond malnutrition, small blue diamond weight shedding, small blue diamond itching, small blue diamond overplucking of the skin, small blue diamond inadequate nutrition uptakes, small blue diamond diarrhea. 5. Bacterial diseases. Due to lack of hygiene and stress, birds often develop various kinds of bacterial diseases, but some birds tend to develop genetic immunity. Bacterial diseases are highly common in birds and they become sick due to the infection. Some symptoms of bacterial diseases are small blue diamond weight loss, small blue diamond illness, small blue diamond loss of appetite, small blue diamond difficulty in breathing, small blue diamond nasal discharge. Environmental stress, emotional stress, and ill health due to other infections or diseases all contribute to a bird's immunity being lowered. Final thoughts. Because of their wings and color, parrots are unquestionably one of the most appealing birds. However, beauty only lasts as long as you are healthy, and the same is true for birds. When a parrot has a sickness, there are various indicators that can help you determine whether they are healthy or not, such as a change in behavior from normal, fluffed feathers, weight changes, and a reluctance to move. Among the 5 common parrot diseases symptoms that afflict them the most, including psittacosis, which has symptoms including a loss of appetite, breathing problems, depression, and droppings that are watery and green, and excessive discharge from the eyes and nose. Swollen abdomen, loss of appetite, vomiting or diarrhea, weight loss, and dehydration are the symptoms of polyomavirus. Pacheco syndrome has tremors, lethargy, sinusitis, and anorexia as symptoms. The 4th is Giardia, which causes diarrhea, dry itchy skin, weight loss, and other symptoms. The last one is bacterial infection. If you notice any of the following symptoms in your birds, you should get medical advice from a veterinarian so that the situation may be resolved. Toxins. Poisons may be ingested or inhaled. Swallowed agents include avocado, causing gastroenteritis and nervous signs, and heavy metals such as zinc and lead causing hemorrhagic enteritis and nervous signs. The inquisitive nature of most parrots means that they will often nibble at things that should not concern them, and make themselves ill as a result. Continual vigilance is required on the part of the owner to ensure that household items like electric cables, small metal objects, or other potentially dangerous items are kept out of the bird's reach. Toxic houseplants or outdoor vegetation accessible to aviary birds may also be a problem. TV remote. Cockatoo destroying a TV remote controller, not a safe toy. The unique anatomy of the parrot's respiratory system makes it very sensitive to inhaled gases. Carbon monoxide, coal gas, cigarette or bonfire smoke, aerosol sprays, and paint fumes will all cause problems to birds. There may be transient coughing or choking, asthmatic attacks, or chronic respiratory disease with prolonged exposure. Perhaps the most toxic and dramatic are the fumes given off by overheated non-stick pan linings or cooking oil. Such occurrences will kill a parrot within minutes. Tumors. Many types of tumor are found in parrots, but budgerigars are perhaps the most susceptible. These may be internal, and would include growths in the liver, ovary or testes, or occasionally other organs. Tumors affecting the gonads will often manifest as lameness, as well as a swollen abdomen. Alternatively, they may be external, affecting the skin, feathers, or preen gland. Most skin tumors are benign accumulations of fat, or cholesterol, but others may be aggressive skin cancers or localized nodular fibrous tumors. Others may be virus-linked. Preen gland tumor xanthoma. Left, tumor of preen gland in a budgerigar. Right, xanthoma in a cockatiel. Virus diseases. There are several of these infectious, intracellular organisms that will cause specific diseases in parrots. Some that are found in other birds, like avian influenza, are infrequently encountered in parrots. Pox virus is occasionally seen in macaws, producing crusty lesions on the facial skin. Adenoviruses generally result in liver disease, and particularly affect lovebirds. Paramyxovirus will affect the nervous systems of small grass parakeets, manifesting as head tilt and circling, with loss of balance. This virus occurs commonly in pigeons and doves, and these birds therefore may be a source of infection to parakeets. A vaccine produced to protect pigeons has been used with some success in vulnerable and valuable flocks of parakeets. In poultry, many tumors are virus-induced, and it is quite likely that similar viruses of the leukosis group are responsible for tumors in budgerigars and cockatiels. Papillomavirus certainly produces wart-like growths in the cloaca and oral cavity. A common herpes virus causes an acute, rapidly fatal hepatitis in parrots and is known as Pashiko's disease. This is most frequently encountered in recently imported birds in quarantine. It will spread rapidly and will wipe out a high percentage of the group in a few days. Polyomavirus generally afflicts young parrots and will result in sudden death, with pale skin and pinpoint hemorrhages visible in the skin and around abdominal organs. Any birds that do survive generally develop abnormal stunted feathering. Circovirus is the cause of the highly unpleasant cytosine beak and feather disease. This virus attacks young growing feather and beak tissue in fledgling birds, as well as damaging their immune system, so they have no resistance to other diseases. In budgerigars it is known as French mold, and although most infected birds will die, some will survive but with damaged wing and tail feathers, so they can never fly and are hence known as runners. In most other parrots, infection is almost invariably fatal. The course of the disease varies with the age at infection and the infective dose of virus. Very young chicks will die quickly, often dropping feathers by the handful first. Older birds will develop characteristic feather deformities or discolorations. White and black birds like the Vasa parrot or pink and African greys. See also cytosine beak and feather disease. Avian bornavirus is responsible for another devastating disease with a prolonged incubation period. Macaw wasting disease, or proventricular dilatation disease or proventricular dilatation syndrome. This virus is similar in its effects to Key-Gaskell syndrome in cats or grass sickness in horses. Initial infection causes mild transient diarrhea, from which most individuals recover. In a small percentage, there is damage to the nerves controlling the stomach, so that this organ becomes stretched, thin-walled and bloated. Digestive efficiency is impaired, so affected birds will eat well but lose weight, commonly vomit, and will pass undigested food items in their droppings. Some birds will also show nervous signs such as tremors or incoordination. Like PBFD, the incubation period can be many months, making the source of infection difficult to define. It is also currently incurable, although isolated pet birds may be maintained by feeding soft foods and giving non-steroidal anti-inflammatory drugs. All these viral diseases have no specific treatments, since antibiotics will have no effect. Thus their control depends on vaccination, hygiene and disinfection, and quarantine. It is important never to mix newly acquired birds with existing stock immediately. They should be kept in isolation for a period of quarantine to allow dormant infections to show themselves. This period should be from 10-30 days, the longer the better. Most infectious agents will show up in this time, but as mentioned with PBFD and PDD, some viruses will incubate for many months. However, parrots can be tested during the quarantine period for the presence of these viruses. Such control measures apply equally to other infectious diseases. Psittacosis. Psittacosis is a common and potentially serious disease occurring in both the birds that we keep and the humans that keep them, and is described in far more detail in its own section, Psittacosis. Bacterial diseases. Because of the open nature of a parrot's anatomy, with no muscular diaphragm to separate the chest cavity from the abdomen, and free communication between the air sac system and the hollow bones, most introduced infectious organisms may start in one organ like the lung or the stomach, but will rapidly spread around the body to produce a septicemia. The list of possible bacteria is long, and precise identification would depend upon laboratory culture and analysis. Such tests can include antibiotic sensitivity, revealing which antibacterial drug should theoretically kill the organism. The choice will be tempered by cost, availability, possible side effects, and the practicalities of its administration to the patient. Drugs given in drinking water are often not taken in sufficient dose by the bird. Palatable and food medications are few and far between, while the daily administration of drops, tablets, or injections is stressful for the parrot and the owner. Common bacteria include the enteric food poisoning organisms Salmonella and E. coli, Klebsiella, Yersinia, Mycobacteria, and many others. Because of the range of organs involved, infected birds will generally show the generic sick parrot appearance, being fluffed up, subdued, inappetite, and with loose, discolored droppings. Fungal diseases. Yeast organisms like Candida albicans cause disease of the digestive system, often following antibiotic usage or damage to the immune system. Hand-reared chicks are commonly affected, with thrush appearing as yellow plaques in the mouth, or infections of the crop, with thickenings of the lining with creamy yellow deposits. Older parrots may have smelly, pasty diarrhea, and stained impression smears of their droppings will show large quantities of yeast organisms. Aspergillosis is caused by the inhalation of fungal spores that grow inside the bird as a fungal plaque in the lungs or on the air sacs. Such spores are present continually in the air we breathe. Small numbers of spores are eliminated by protective white blood cells in the body. Active infection arises either when large quantities are inhaled, such as when mold grows on food or droppings left in the cage or aviary, or the parrot cracks open a stale nut, or if the bird's immune system is weakened by poor diet or virus infection. It is very common to find aspergillosis in young African gray parrots. Many of these birds turn out to be infected with PBFD virus. The fungus causes disease in two ways. Firstly, the physical presence of the mold growth will affect the bird's breathing. Fungal colonies developing at the base of the trachea result in an acute, choking problem, with rapid death without emergency treatment. Growth in the lungs will lead to pneumonia, while that in the air sacs will cause more insidious, gradual breathing problems. Meanwhile, the fungal colony releases a toxin into the bloodstream that attacks the liver, causing death by toxic hepatitis. 2 articles were published in the Parrot Society magazine in 2021, describing this unpleasant disease and its devastating effects in more detail. The first describes the science of the infection and its signs and effects. Aspergillosis won the science, while the second article describes the emotional effects on the owners of affected birds. Aspergillosis to the emotion. Megabacterium is an organism something between a bacterium and a fungus, which is treated with a combination of antibiotics and antifungal drugs. Its most common manifestation is as a chronic digestive disease in budgerigars, with vomiting and weight loss. Macrorhabdus. Macrorhabdus ornithogester staining dark purple in a fecal sample. Parasites. These may be external or internal, and are generally larger organisms living on body tissues of their host. Internal parasites include protozoa and coccidia, although these tend to be less of a problem in parrots than in poultry and other bird species. The exception is trichomonas, which causes canker in pigeons or frounce in birds of prey. This organism will also frequently infect budgerigars, resulting in chronic vomiting and weight loss, similar to megabacteriosis. Tapeworms are seen occasionally in recently imported African gray parrots or cockatoos, and will appear protruding from the vent as a creamy gray wriggly ribbon 2-3 mm across. Roundworms are far more common, especially in ground-feeding birds like grass parakeets and some cockatoos. They may be passed in the droppings, and appear as 2-3 cm long, pointed at both ends. Roundworms. Ascarid roundworms in cockatoo droppings. External parasites include ticks, lice and mites. Ticks live for much of the year resting in vegetation, but will climb to find a suitable host when they require a meal of blood. They are found particularly in areas where there are sheep, rabbits, or hedgehogs, and most vulnerable are parrots and outside aviaries with overhanging plants. The ticks will attach to the unwary bird by way of their sharp, barbed mouthparts and suck blood over the next few days, swelling in size as they do. Once sated, they will drop off, but they inject an anticoagulant into the puncture site. Some birds will react to this substance, and will be found suddenly dead with no previous signs of illness. The tick may or may not still be attached. Control of this problem depends on the removal of overgrown vegetation from around the flight. Lice and mites living on the feathers and skin are far less common in parrots than they are in species like canaries, poultry, and pigeons. However, quill mites that live within the feather may be a cause of some feather plucking problems. The most common external parasite found in parrots is the scaly face, leg mite C. nematocops, and this is most frequently encountered in budgerigars. This is similar to the mange mites of cats, dogs, and foxes, and burrows into the skin, resulting in crusty, thickened skin in affected areas. Historic treatments include the use of liquid paraffin or petroleum jelly, which will have the effect of suffocating the mites, or benzyl benzoate applications, which gradually will kill the parasite. However, these treatments require prolonged, repeated applications to achieve success. Current medication is by application of the parasiticide ivermectin. This is absorbed through the bird's skin and kills the mite via the bloodstream. Generally 2 applications 10-14 days apart will be successful, although in severe cases a third may be required. The infestation appears not to be highly contagious. Only a few individuals in a flock may show signs. There appears to be a need for immunosuppression in the bird before the mite can multiply sufficiently to show clinical disease. Scaly face. Severe scaly face infestation in a budgerigar. First aid care. It should by now be obvious that there are many disease conditions that can potentially affect your birds. Precise diagnosis and specific treatment is the province of an experienced avian veterinarian, but several common-sense precautions may be taken to avoid such problems. These include quarantining new arrivals, as mentioned above, and not mixing new birds immediately with existing stock. Good hygiene and regular disinfection of food and water bowls, perches, nest boxes, toys, and cages are essential. The control of vermin and the secure storage of good quality food in airtight containers are important. Selection of sound, healthy stock in the first place is obviously wise, and the feeding of a top-quality, well-balanced diet, suited to the species is paramount. Finally, regular observation of your birds, to identify subtle changes in their normal behavior and attitude, will enable you to spot problems before they become too advanced. If you do consider that you have a sick bird, then there are 3 useful things to do. The first is isolation. Separate the bird from any companions and bring it into a small indoor cage. This will allow you more closely to observe it and monitor its progress, more easily to administer any medication that may be required, hopefully to avoid further spread of the disease should it be contagious, and to avoid bullying of the sick bird's other members of its group. Secondly, warmth. Birds have a high metabolic rate and will expend a lot of energy just to maintain their body temperature. Supplying external warmth will aid the bird's recovery by enabling it to divert energy to getting better. This may simply mean bringing an aviary bird indoors. Alternatively, use a heat pad, a hot water bottle, an airing cupboard, or place the cage near a radiator. It may be worth investing in a hospital cage or an infrared heat lamp. The third important home therapy is fluids. Sick birds will dehydrate rapidly, especially if they have vomiting or diarrhea. Encouraging their fluid intake by sweetening their drinking water with honey, sugar, glucose, or fruit juices will prove invaluable. Better still are proprietary oral electrolyte solutions. If the parrot will not drink voluntarily, these must be administered by spoon, dropper, syringe, or crop tube. Resist the temptation to reach for the old pot of antibiotic powder at the back of the cupboard, or worse still, use some prescribed for a friend's birds. As I hope by now I have made clear, antibiotics are effective only against bacterial infections, which account for about 25% of sick birds. You will do far better to give a probiotic, as well as the fluids and electrolytes, until you have obtained a proper diagnosis. This will have the effect of boosting your bird's immune system and aiding its digestion, while it recovers. Birds can be enjoyable pets and loyal companions, but it can be distressing when your feathered friend shows signs of illness and isn't its usual chirpy self. Recognizing common pet bird diseases and knowing the best solutions for these conditions can help you be sure your bird leads a healthy and happy life. Most common pet bird diseases and how to help. There is a wide range of diseases that can infect pet birds, but different bird species have different susceptibilities to various infections. The most common conditions that can affect a wide range of popular pet birds include parrot wasting syndrome, also called macaw wasting syndrome or proventricular dilatation disease. This illness is characterized